David, we're just 2 days from President Obama's televised healthcare meeting. Help us understand what we might expect of it. First of all, are we going to hear anything that we haven't already heard, do you think?
Not in the big picture. I mean, we've been debating this for a very long time. The Republicans know the Democrats' ideas. The Democrats know the Republicans' ideas. This is not a session for them to really hear new things. It is much more political than that, and the fact that it's televised is really the key to this event.
So is it really just political theater, or might something of substance come from it?
Well, it really is political theater, but the reason that something of substance may come from it is that political theater matters. If we think over the course of the debate this year, the summer was a very bad time for the White House and Democrats. There were these town hall meetings where people got very upset about health care. And then Obama came back and gave this speech to the joint session of Congress that steered the debate back the Democrats' way. And then we had the election in Massachusetts, which really steered it very sharply the Republicans' way. And even though the Democrats, if they wanted, could still go out and pass a health care bill tomorrow. And so politics matters, and this does have the potential to be an event that either kills health reform off or gives it a bit of a boost of new life, which is clearly what the White House is hoping here.
Do you think this really is a last-ditch effort? I mean, President Obama has really stuck his neck out here more than ever before. If we can't get a deal here fairly shortly, does it mean that health care is dead for the rest of his term? First
of all, if he can't get a deal here, it's not good for them and for the White House. If they can't get a deal, they'll come to something much, much smaller, where they'll just look to cover some relatively small number of people in little ways, almost Clintonian ways, and then maybe you can imagine them returning to health reform at some point. But I think if they don't get a big deal here, we are not going to have any kind of major health reform for years and years. I mean, these things tend to come up every 10, 20 years. The last one was Bill Clinton in the early 90s. If they don't get a big deal here, I would be surprised if we get a major health reform anytime soon.
Now, David, you're writing in a story for Wednesday's newspaper about it's not just the fault maybe of Republicans and Democrats who can't agree here, but there's just been extraordinary amounts of lobbying by big business, by unions. How much is that lobbying a factor in the failure, so far at least, to get a deal?
It has been a factor, and it's been a factor in both the little and the big way. In the little way, lobbying affects the way Congress works. And in the big way, the attitude that unions and businesses and the like take toward health reform affects people's attitudes toward health reform. And people's attitudes, in turn, affect what the government does. And so what we've seen is we've seen a lot of groups. We've seen AARP, we've seen labor unions, we've seen business groups. They've really been quite opposed to a lot of measures that would reduce health cost growth. And you can go down the list of examples, measures that would make it easier for people to choose their own insurance as opposed to having their companies do it for them, measures that would tax high-cost insurance plans. You go through all these things. People have looked at this, and in fact, evidence that we have suggests these would reduce health costs, would help us in the long run. And yet all these different groups have opposed them, and part of it is their narrow interests. Part of it is also that change is kind of scary, and you look at that and you think, wow, that may be worse than it is now, rather than, wow, that may be better than it is now. And so there's been a lot of that in this case.